Along with Hawaii's general population getting older, there are more aging homeless residents as well.
The number of kupuna in shelters has more than doubled over the past decade. Paul Drews shows us the impact of our aging homeless residents.
Along with providing homeless residents a place to eat and sleep, Institute for Human Services shelters have also had to provide more walkers and wheelchairs to Hawaii's aging homeless population.
You're just seeing the beginning of a whole tidal wave, I think. We know that our whole population in Hawaii is aging. Among the homeless is no different. And so we really need to be prepared for that. At IHS shelters, about 20% of residents are 62 or older. That rate increases to about a third for senior veterans in shelters. And many feel being homeless ages people on the streets and in shelters.
It's always a daily challenge of keeping yourself together and maintaining your own self-respect and guiding yourself through it.
Michael Wilkins has been living at the Iwilei shelter for several months, and at 65 years old has far surpassed the average lifespan for Hawaii's homeless population, which is only 53 years old.
If you lose that many years of your life in general, average-wise, if you're counting people at 55, I think it's reasonable to consider them kupuna,
About a third of the homeless residents at IHS shelters are 55 and older, and that jumps to nearly half when it comes to homeless veterans age 55 and older. Caring for more aging homeless residents means making shelters more senior-friendly, with grab bars and bathrooms and more beds on the ground so they don't have to climb into bunks. Hearing and vision can diminish for those residents, while the need for help with medications and regular health care increases.
Well, I've had open heart surgery and a valve replacement, which they've been able to help me keep on my medications and keep track of whenever I start to run out. They make sure that I have other backups on it. I also have a COPD breathing problem, which they take care of, making sure that I'm always on my medications.
Chronic homelessness tends to come with additional chronic health conditions as well, especially for longtime alcohol or drug addicts.
Many times, your liver, your heart, your organ systems are just really in disrepair. They really are failing. And so when you put all of that together, you just have a lot more needs, for the person.
IHS is now working with the city and state to help develop programs so aging homeless can maintain cognitive abilities. But with the increase in aging homeless residents, there's concern there won't be enough care homes for those who won't be able to take care of themselves.
Do we have these spaces available for people? No. We have to think about developing more assisted living places.
Paul Drews, Island News.